The minor injury guideline is a series of regulations about the amount of treatment you're entitled to if your insurance company has made a determination that your injuries are of such a minor extent that they need not meet their full obligation to you, which according to everybody's standard auto insurance policy is medical treatment, $50,000 over 10 years if it's reasonable and necessary to help you recover from an automobile accident. The minor injury guideline reduces that to $3,500, and any insurance assessments done will come out of the $3,500. So quite often we see people getting maybe $2,000 worth of treatment and the insurance company charging them on their own insurance $1,000 to have insurance exams that say they shouldn't get any more treatment.
Except in the clearest of cases, for example, if there's a case where somebody has multiple fractures or they're unconscious at the scene, the majority of accident people are being placed in the minor injury guideline. This happens when they visit a treatment center. The treatment providers, if they complete an OCF 23 rather than an OCF 18, which is a treatment plan, the claimant is automatically placed in the minor injury guideline, and the treatment facility is automatically paid for their work up to $3,500, which includes their assessments. On the other hand, if an OCF 18 is completed to do a full assessment and determine what treatment may be reasonably required, the insurance company only, and to generate treatment plans, the insurance company only has to pay for the OCF 18 if they agree. Therefore, many of the treatment providers aren't prepared to complete OCF 18s, which means they're only doing a very summary assessment, and the person injured in the motor vehicle collision is being left with less than $3,500 in treatment at a time when they need it the most to obtain maximum medical recovery. The onus is on the person who is hurt in the accident to convince the insurance company that their injuries should not fall within the minor injury guideline. From the outset, this is made more difficult by treatment providers completing OCF 23s and placing them in the minor injury guideline. The other way to provide compelling evidence that a claimant should not be in the minor injury guideline would be through their family physician.
And there's a couple of things here that we have to remember. The science is incontrovertible. Early treatment prevents the development of chronic problems. We all know this. Limiting it to that 2,000 can virtually ensure that a certain percentage of those people are going to go on to have chronic conditions. And the other point is, by terms of their own rules of practice, a physiotherapist is not competent to put somebody in a minor injury guideline, but they're the ones selecting which form to send in, and it's outside of their scope of practice.
The minor injury guidelines based on a review of a person's health pre-accident and post-accident to determine if there's issues that may be barriers to recovery which would make it inappropriate for a person to be in the minor injury guideline. So often people are visiting a treatment facility shortly after the accident. The person who's completing the OCF 23 hasn't seen a complete copy of the injured person's clinical notes and records and doesn't make the inquiries to determine if there are barriers to recovery, and also isn't qualified to make that determination. Instead, the OCF 23 is simply submitted.
According to the rules governing insurance in Ontario, and everybody should know this, automobile insurance, financial interests, all are governed by the Financial Services Commission of Ontario, known as FSCO. And FSCO, when you hear about auto insurance changes, it's FSCO that has, in consultation, decided what the new insurance policy is to look like. Like I said, from $50,000 worth of treatment down to $3,000 worth of treatment, things like that. Fiscal mandates that the minor injury guideline is only to be applied at the acute and the subacute phase of the injury, which means within weeks. If you're still having problems a month or two down the road, you are past the acute, which is, immediately after the accident, and the subacute, which is the period of healing that normally comes after the accident, and you're starting to move towards a chronic condition. The insurance companies have not been looking at that part of the regulations. So they're leaving people in the make. They're saying, you've used up your money, bye-bye.
The regulation specifically talks about the $3,500 cap is set out in the minor injury guideline, should not be applied where it will not be sufficient to allow someone to make an optimal recovery. This is being completely ignored by the insurers. When the $3,500 is used up, if you haven't provided compelling evidence or shown that there's a fracture or an MRI result that shows a complete tear, not a partial tear, they're just leaving people subject to the minor injury guideline, and where they are virtually unable to find a way out for months until they seek counsel who are experienced in dealing with accident benefits. One of the most important things to do is to talk to your family doctor as soon as possible after an accident and ensure that your doctor makes notes of all of your complaints related to the accident. For example, if you're experiencing symptoms consistent with a concussion, that should be noted down. It may be sufficient to get you out of the minor injury guideline. The easiest way to get out of the minor injury guideline is to have some compelling evidence from your own family doctor, send it through to the insurance adjuster. The insurance adjuster ideally reads it and agrees and removes you from the minor injury guideline. Unfortunately, at this point, there's no case law on the minor injury guideline, so that's not happening as frequently as it should. When that doesn't happen, the only other option appears to be to issue a statement of claim against your own insurance company. The Financial Services Commission of Ontario is taking the position that they do not mediate the applicability of the minor injury guideline because there's no, unless there is treatment in dispute. And there's not going to be any treatment plans in dispute unless you decide to pay $600 or $700 per treatment plan to a treatment provider to submit them. So the next step, if your insurance company doesn't agree with you that there's medical evidence that would warrant you being removed from the minor injury guideline, it's imperative that you find counsel who can assist you in suing your insurance company as quickly as possible. Otherwise, you may be left without treatment during the period of time when you can make the maximum benefit from that treatment and make an optimal recovery.